Out of Albert Lea, where we are following up on Mayo Clinic's announcement about closing 6 outpatient clinics across the state.
ABC 6 News reporter Brandon Antony tells us how that's affecting our area.
Some services are being moved to Austin and Waseca later this year, having residents and some city leaders concerned given the already lack of options nearby. It's an issue that has been going on for quite some time in rural health care communities like Albert Lea. And with Mayo announcing their most recent consolidation efforts and citing declining patient numbers, the struggle to find quality care continues in this area.
For those that have the means of their own transportation, it's a matter of convenience. For those that do not, it is a matter of access.
I asked the city of Albert Lea specifically for their thoughts on Mayo moving even more clinical care options out of the city, just a couple months after the announcement that Mayo was pulling express care clinics out of Hy-Vees in Austin and Albert Lea. They said, unfortunately, this is the new normal.
We're seeing more and more healthcare providers scale back. Unless if you're a community that is extraordinarily large and has a very large healthcare campus, you're going to have to start to travel eventually. Any rural areas are going to have to travel more and more.
But they wish Mayo, the biggest hospital in our area, did a better job of providing for more vulnerable patients.
They need to find ways to bring in those who have limited mobility, limited transportation, and bring them to them. That is something that I do believe Mayo needs to greatly work on and improve.
The Albert Lea Health Coalition agrees, saying they aren't surprised, but are disappointed by Mayo's decision. After all, the group formed after Mayo Clinic first moved services out of Albert Lea to bring a new provider to the area.
We're not surprised by it. You know, when this first happened to us, it was a shock. It really was. But I think that I think this was probably the plan all along.
However, Mayo says they remain committed to rural health and continue to invest in improving care access. The community is coming together trying to bring another primary care option to the city.
They're interested in putting together basically a primary care clinic. And we should know if that's going to happen within the next 4 to 6 weeks, I think.
I'm told changes specific to Albert Lea will take place after December 10th. You can find more information on our website at KAAL-TV.com. In Albert Lea, Brandon Antony, ABC 6 News.